My name is Cheryl Matheis. I'm a Senior Vice President for Health Strategy at AARP. Well, I'm excited to come to this conference because healthcare reform law recently passed is a big law. There are a lot of implications and it affects a lot of people. And this conference in particular has sessions for every single group that's interested in it. So I expect to see a lot of different people here and hear a lot of different opinions about what it means from the standpoint of the different perspective. Certainly, healthcare reform really affects our members. You know, our members are people over the age of 50. And so half of them are between 50 and 64. So they either work and get insurance through the workplace, or they have to go out and buy it on their own. And if they have to go out and buy it on their own, they are among the most expensive people to insure. So this law gives a lot of new protections for those folks, and that's something we worked really hard for. The other half of our members are over 65 and they have Medicare. And while they love Medicare, and they really do, their out-of-pocket costs on Medicare have been going up significantly in recent years. And you know, their income doesn't go up. They have a stable income. So for our older members who are on Medicare, it was really important for us to protect their Medicare benefits and to close the prescription drug gap in the drug benefit so that they would have a prescription drug benefit that is similar to what people who are employed have. Well, I think the idea of medical tourism is one that is just starting to catch hold in people's minds. There is a lot people don't know about it. In fact, that's one of the things that I was here to learn about. A lot about the quality of care overseas. In some places overseas, the quality is very, very good. In others, it's not so good, and it's important to figure out how you tell the difference. I think we are going to be living in a global healthcare economy, and so the pressures on healthcare providers in the United States will come from overseas, because where there are good quality services like surgery in places overseas that is so much less expensive than it is in the United States, it's going to put pressure on the doctors and hospitals in the United States to compete with that. I think that seniors, first of all, seniors love to travel. 65 now is not what 65, 15, or 20 years ago was like. And so a lot of them, if they have the income to travel, are very happy to travel. So when you combine that with, are they willing to travel for healthcare services, I think the question is, it depends. And I think that's something that we're going to have to figure out over the next several years. I think the highlight from my perspective is to see people who are involved in healthcare from many different perspectives coming together and finding out how many similarities there are in their viewpoints and what the differences are, and trying to figure out how you resolve those differences to find out what things really mean and what this new law really is going to mean. This Congress is reaching my expectations very much, because I think, when you just look at how many different people are here and the different organizations they represent, it's very hard to assemble that rich of a diversity of organizations in one place, and the conference organizers have done that here. Well, I think the element that I think is most valuable is getting to talk to people once you meet them in the networking meetings. And the way you meet them, if you don't already know them, is by listening to their presentations and talking to them afterwards. Oftentimes, either the question and answer period of a presentation or the opportunity to talk to a speaker out of the meeting is the most valuable part of the meeting.